Oh, no sound. Oh, wow. That's not good. I'm gonna have to re-record this. Wow. Wow. Okay. Well, shoot. 9 minutes. All right. Well, let's okay, so well, that hurts. All right. Thank you for letting me know. All right. So Medicare Advantage season for next year is gonna be crazy. There are close to 2 million people that are gonna be get their plans canceled. There are a lot of people that are gonna be shocked for 2025 when they go into their doctors, they go in their hospitals and find out their plan has been canceled or downgraded. They're gonna have extra charges when they go to the hospital. So I don't want to repeat everything. I'll make another video and I'll go ahead and update it a little bit later. I'll put it on the regular videos of all the things that we need to address here. All right. Thank you very much. All right. So yeah, so I'll go and make another video on that. All right. So let's go ahead and jump into your questions. All right. No sound. All right. A bunch of videos on no sound. All right. I had some questions in the beginning there. See, this is a completely live here, right? This is not these all right. Okay. I have a Medicare and Medigap SSI. Currently in Medicare in Texas, Medicaid QMB chose not to enroll in dual advantage plan for freedom to see any provider. Can I keep Medigap? If you have so you have, okay, you don't have Medicaid, or you do have Medicaid QMB. Normally, no, you cannot keep a Medicare supplement plan. Each state is a little bit different, but I'm almost sure you cannot keep a Medicare supplement. Let me check my volumes one more time. You cannot keep a Medicare supplement plan when you have Medicaid. And the reason is that the Medicare supplement plan, they're supposed to, the reason you're paying that Medicare supplement plan is because there's gaps there. And that Medicare supplement company is supposed to cover those gaps of original Part A and Part B of Medicare. But if there's no gaps because Medicaid paid for it, then that's not bueno, right? That's not good. So that's why it's pretty much impossible to get or keep a Medicare supplement when you're on Medicaid. So yeah, I would definitely check that out. All right. I have a question about the max Social Security. Does the max Social Security include the COLA, or does it come out after? Yeah, when the COLA comes out, the Social Security computer system just basically takes that COLA 2.5% for next year and just multiplies it by 76 million people on Social Security, and it includes the calculations in the online Social Security My Social Security account. So the but it takes a little while. And so if you go in there today, it should reflect the 2.5% for next year. So yes, everything is automatically calculated in there. All right. Yeah, Marine, I should have, yeah. Improvise, adapt, overcome. Gunny Highway. All right. All right, let's see here. I was 65. I'm a U.S. citizen and Canadian permanent residence. Wife has coverage for me. I'm paying for PTB. Part B. Do I need it, and can I cancel without penalty? You can cancel it anytime without penalty, but the penalty comes when you re-sign up for that. So if you change your mind later and you decide to go ahead and sign up for Part B, then you'll get charged 10% for every 12 months you did not have the Part B. But you said your wife has coverage for you. So if that is, are we talking about your wife is currently working and currently has health insurance from work, and that employer has 20 or more employees? If that's the case, then you're good, because you have health insurance from work, current work, yours or your spouse's. So if that's the case, you can go ahead and cancel Part B. And then when you stop receiving that health insurance from current work, it sounds like your wife's, then you go ahead and sign up and there's no issue. Okay. Penelope, Medicare cards used to have our Social Security numbers on them, but they changed that a few years ago back for your yes, privacy or protection. That was crazy, wasn't it? That Social Security, again, I ran the third business Social Security office in the country, and all the time, um, we used to tell people, don't carry your Social Security card around with you in case you lose it. You got your Social Security card and you got your driver's license with your date of birth and stuff like that. But then you had to carry your Medicare card around and it had your Social Security number. So that was very, very stupid. They finally got smart and put it on a different number. It's just a completely arbitrary computer generated number. So it's not like Social Security type thing goes by your area or anything. I have a question, please. Can I try to get disability if I'm on Social Security? Um, Yes, if you are we talking about Social Security? Are you just talking about regular retirement benefits? If you're on regular retirement benefits or survivor benefits or spouse benefits and you're disabled before your full retirement age, absolutely, you can try to go ahead and get disability. I've done a few videos on it. Make sure you watch them and absolutely go through the process. It takes forever, unfortunately. I have Medicare Part A and B, also have TRICARE. Is that good enough? Yep, that's good enough for most people out there. Some people get a Medicare Advantage, but with TRICARE, that's kind of your Medicare supplement. So if you're happy with it, then it's a beautiful thing. I was married twice, 16 years, the second for 21. The first one is deceased, and the second one is 8 years younger than I. Will I be able to collect off the younger? He probably made more. Yes, as soon as you are 62 years old and he is at least 62 years old, then you can collect for benefits on his record. You'll have to collect benefits on your own record if you're entitled. And then if his benefit is twice as much as yours, the full benefit amount benefit, then you can go ahead and collect benefits on his record. Um, I just finished talking to James at Chapter. He said, because I only have XX, I try to not to mention names in my area. My only choice is another one. Can you tell me a little bit about? Yeah, no, that's both of those are pretty much national companies, and they're you know, they're all regulated by Medicare, CMS, the Center for Medicare and Medicaid Services, and all those plans are approved by Medicare that they fill all the requirements. So I understand at 65, still working full time, individual needs to apply Plan A. About how about Plan D? The individual has full health coverage currently. If you have full health coverage, comparable, credible health coverage from current work, then you do not have to sign up for Part B nor Part D. There was a little bit of issue a few months ago about whether, because of the Inflation Reduction Act, whether credible health insurance companies, private health insurance companies, were going to be credible coverage for Part D. But it looks as though the government kind of kicked the can down the road there, and it doesn't seem like it's an issue. But if you have health insurance from work, and your employer has 20 or more employees, it has to be current work, not not the Obamacare, Affordable Care Act, or COBRA, or a retirement plan. It has to be through current work. So if you do, then you do not have to sign up for B or D or C or any of it. What's C? C is Medicare. C is the Medicare Advantage plans. I don't like them calling that because it sounds official. I'm going to do a video tomorrow on possibly the future of Medicare Advantage. Hopefully, I'll have audio for the first 5 minutes. I have Medicare and Medi-Cal. Yeah, California calls Medicaid Medi-Cal because they like to confuse us. Are we going to lose greatly? Anything I can add? If you have Medicare and Medi-Cal, essentially Medicaid, if you have the higher levels of Medi-Cal, then you might be able to get a Medicare Advantage dual eligible plan. So I would definitely reach out to Chapter there, and they can see if you have the higher levels of Medicaid, Medi-Cal, and see if a dual eligible plan is right for you. Those are the ones with all the the shiny benefits there. So. Yes, and we'll make you tired. All right. I just received my first Social Security check 2 weeks ago. I'll turn 65 February. Can I wait until the dust settles to decide which plan I will go with? Maybe a supplement plan? Yes, you are not part of the whole December 7th thing because you're new to Medicare. So you can basically wait till the end of January. I wouldn't recommend that. I would, get everything, start processing probably in, first part of January, or once the dust settles, you said December 7th. If you want to reach out to Chapter, I would let them sleep for an entire day, 24 hours sleep to get over this crazy season. Give them a call on the 9th or 10th or 11th of December, and they'll go over all your options, see what's available in your area. And if you're leaning to a supplement plan, then yes, absolutely. I always recommend a Medicare Supplement Plan N first. Check out that one first, and then check out a G. And then if those are just not right for you, then go on down to Medicare Advantage. I'm going to live in the Philippines and can't use my Medicare. How do I cancel Part B? Yep, you just contact Social Security, and they have you fill out a form that you recognize that if you decide to sign up later, you get 10% penalty for every 12 months. So if you're never coming back to the United States, then yeah, a lot of people cancel Part B, but situations change and all the rest of it. So, could you please explain Social Security hold harmless rule? So are we talking about, yeah, there's kind of different characterizations on that. It's probably part of an overpayment type thing. And is that what we're talking about? Yeah, Social Security kind of uses that term in different categories. So let me know what if it's terms of an overpayment, there's two things have to be met in order to get an overpayment waived. It's not your fault, and you don't have the ability to repay. And there's also kind of a compassionate type of situation. I have been partially self employed for about 15 years. My Social Security earnings record does not reflect that I paid my match for Social Security and Medicare. Why do they show no extra paid? Because you didn't pay. That's between you and the IRS. Once you file your taxes with Social Security and the IRS does their thing, then they just notify Social Security. So if you did not, if you're a 1099 or you're self-employed, then Social Security just gets that information from the IRS. So you need to contact the IRS and find out what happened with their records. I live in a foreign country where Medicare is not available, so I decline Part B. I'm working remotely for a U.S. company and have private insurance. What do I do if I start working? Advice? Yeah, if you're working overseas with an American company, then that's considered, coverage. So you do not have to sign up for Part B. Just when you come back and you want to sign up for Part B, then you have to have that company fill out a form. It's a 564 is the form name, and they just confirm that you did have health insurance from work since you turned 65, and they'll get you all set up. If you have a supplement, is there anything we can get to cover dental, hearing, and glasses? Yes, separate plans. There are dental plans out there, hearing plans, vision plans out there. So that's what people do. They, sign up for Part A, Part B, they get their Medicare supplement, the N and G. They get their prescription drug plan. Make sure you get that. And if they want, they can get a dental or hearing plan as well. What are the rules after full retirement age, collecting Social Security and working tax and income level amount? In terms of Social Security, after you hit your full retirement age, you can make $1 billion a month, and it doesn't affect your Social Security negatively whatsoever. So no issues working after your full retirement age for Social Security. Ed, can I run my own underwriting for approval? Once approved, can I then decide if I want to go through with supplement plan without penalty? Run my own underwriting. I'm not sure what that means. The health underwriting, is basically when you sign up for a Medicare supplement plan. If you're not in your initial enrollment period, 65 or new to Part B, then you have to go through health underwriting, medical underwriting. It's, they don't necessarily have you go see a doctor or anything. It's, they ask you some questions, and if you pretty much say no to most of them, then you're good and you get a Medicare supplement. Some of the Medicare supplement plan companies, the Plan G is a Plan G, Plan G, they're all the same. The price is different, and the companies are sometimes different in the sense of, sometimes a company will look back 3 years at your medical history. Other companies will look back 5 years. So it really depends on that particular company in your particular state. So, Lynette, when I filed for Social Security, I was married for 18 years and divorced. I gave my ex's Social Security number, but later found out I was not drawing on my ex's. I called Social Security and was given bogus info. What can I do? File a reconsideration, an appeal. That's an SSA 561. So yeah, maybe you gave them that information, but there was no money there left, in the sense of, you have to file for benefits on your own record. And then if your ex-spouse's benefit amount is twice yours, then you'll receive that difference. So maybe there wasn't more money at that time, and that person has since worked and increased their benefit. Maybe there is now. But or they just messed up and didn't give you that spouse benefit amount. So yeah, SSA 561, it's a request for reconsideration, and you say, hey, 2 years ago I asked about this and y'all messed up, and I want that money plus I want the back pay. So I have Medicare Independent Health HMO. Am I okay? HMO considered as Medicare Supplement or Advantage? And HMO is Medicare Advantage because a Medicare Supplement plan does not have a limited network. They, as I always say with Medicare Supplement, your network is America. Any doctor in the country that takes Medicare will take your Medicare Supplement plan. People, Ed, no, that's not true. This doctor wouldn't take it. Wouldn't take your supplement. Oh no, they weren't accepting new patients. Well, I can't help that. If they're taking new patients, but they do take Medicare supplements if they take original Medicare. So if yours is an HMO, that's a Medicare Advantage. So I would definitely reach out to chapter there and say, hey, is this the best plan for me in this particular area for 2025? I have original Medicare and TRICARE for life as a retired military dependent. Am I eligible to buy a supplement F or G, which TRICARE says they will not cover if Medicare will not cover? Yes, yes. Maybe not an F because you have to be elderly, born after before a certain date, but a G or N or something, yeah. If pass health underwriting, I wouldn't recommend it because that's going to be more money out of your pocket. But if you want to, yeah. TRICARE for life is basically your Medicare supplement. So, yeah. I just turned 62 and filed Social Security, also filed IEDS since my ex is 64 and was told they need to speak with my ex first. Does this seem right? See, the issue is with the independently entitled divorce spouse benefits, because that person hasn't filed for benefits. They're not asking that person permission or anything like that. Hey, can what's your name? Tess file for benefits? They're not asking for that. They just want to confirm a couple of things, whether that person's earnings record is correct. Because if it's wrong, then you're going to get the wrong benefit amount, and you're going to overpaid or underpaid or whatever the case may be. Or if that person's receiving like a non-covered pension, they were a cop or a, firefighter or a teacher in certain parts of the country that they don't pay into Social Security, and then if they are, then you might get overpaid or underpaid or whatever the case may be. So that's why they kind of reach out sometimes just to confirm you're going to receive the correct benefit amount. But if you just don't want Social Security to contact that person for whatever reason, then you just tell them, no, do not contact that person. And they'll probably have you, fill out a form that says, okay, we're going to do it based on, the earnings record that we have in the system, with the understanding that if it turns out to be wrong, you're going to pay back the money that you were overpaid. Or, if we don't pay you enough, then we'll pay you that extra benefit amount. So, yeah, some people just, yeah, absolutely. I don't want you to contact them. So, hello, came on late. If the new administration decides to make Medicare Advantage the default for Medicare, can the president do this by executive order, or does it have to go through Congress? Um, yeah, I guess I would defer to the Supreme Court, and the Supreme Court, pretty much right now is, yeah. So there's that. I'm going to talk about actually that tomorrow. So. I'm the one with the younger second husband. I'm 61 and he is 53. So it doesn't look like I will be able to collect if I want to retire in 2025. You'll be able to collect on your own benefits, but no, you will not be able to collect on benefits on your spouse because he is underage, I guess. Yeah. Unless he's receiving disability or something. I'm retired from the previous employer. I was able to continue taking the same medical insurance. Is this option okay for me not needing to take Part B Medicare? The job does have more than 20 employees. Um, okay, so you're retired. Yeah. So if you're receiving health insurance from a retirement plan, then you have to sign up for Part B. But as we used to say in the Marine Corps, nothing is mandatory, but the repercussions are the repercussions. Um, so if you are 100% happy with your retirement plan, and you know for sure that retirement health insurance, they're going to offer that forever until the end, then that's your decision. But if for some reason 5 years, 10 years down the road, that company, the CEO decides to go buy himself a new yacht and uses your medical your health insurance, fund as, down payment, and then you lose your health insurance and you come back to Part B, then you're going to have to pay a penalty for the rest of your life, 10% for every 12 months. So there's that. Mom says she was told by Social Security she could not claim any spousal or survivor benefits for my father who passed in '03. Worked 40 years for public transit and was honorably discharged from the United States Marine Corps. Shouldn't she be getting multiple benefits? Um, Possibly, yeah. He was a Marine, so he didn't make very much money there. But he also public transit, so maybe they didn't pay into Social Security, or maybe her benefits were higher. So if her benefits are higher than his, then no, there's no more benefits there. There's no more money there. I started collecting Social Security in 2022, but had been rejected in 2010. But when I turned 65, because I live in Canada, don't they owe me for 12 years of missing payments? Is there a special form? Yeah, the SSA 561. If you disagree with any type of decision Social Security makes, you file an appeal, and that's the SSA 561. So I am 61. Can I collect on my husband that passed 4 years ago? And can I get any kind of back pay? Also on workers' comp, can I still collect? Yeah, workers' comp has no effect on Social Security survivor benefits at all. You're past 60, so you are eligible for survivor benefits. There's obviously work limitations. But yeah, if you were married to that person for 10 years, if it was a divorce type situation, if you were married to that person for at least 9 months and you were married when they passed away, then you're entitled to those benefits. Um, and you obviously haven't touched your benefits yet on your own record because you're only 61. So what you can do is go ahead and collect survivor benefits and don't touch yours and let yours increase. So, yep, I would call up Social Security. And if you don't know that person's Social Security number, no problem whatsoever. You just tell them the person's name, their date of birth, and where they were born, and Social Security will find it. So, oh, okay, I already talked about that one. Ed called chapter today, retired military going to the VA. He said that something plan would be the best as I would get back $150 of the 185, being that in retired military. Yeah, so that's the that Part B give back plan I was talking about that you couldn't hear me. I don't know why you couldn't hear me. Maybe because my microphone wasn't on. I checked before I started too. Yeah. Anyway. All right. Yeah. So awesome. That's why that was probably that particular plan is probably called the Honor Plan or the Patriot Plan, or it's just Part B Give Back. So that's a beautiful thing, $150 back in your pocket. And since you use most of your things for the VA, so you use your VA, but you've got a fallback position and you're not paying that much money for it. So it's a beautiful thing. Awesome. Thank you for covering the Advantage plan tomorrow because we are so close to the deadline and would be great to have a session just on Medicare. Yeah, that's what this session was to today. If I didn't mess it up, but we can talk about it right now. So yeah, so the December 7th deadline, there's going to be millions of people that are going to be shocked, and they're going to come on here in the Q&A. Ed, you told me to check and I didn't check, and I just went to the hospital and they charged me 3 times more than I thought they would, and I had I told you to check. But everybody, I think this is the fault. This is a self-inflicted wound of the Medicare BS. The whole thing is because all these people go out there and they harass you with the phones and social media. I guess that's what I'm doing right now, and the emails and the mail and stuff like that. And people just throw up their hands and say, "I'm just tired of that. I never want to talk about Medicare again in my entire life." And because of it, and I understand that sentiment, but you kind of have to, particularly this year, because there's so many changes for next year. You really, really, really have to review your plan, and health insurance companies hope you do not. So I think that's why one of the reasons, their grand strategies is to make you throw up your hands about the whole thing and just stay where you are, and that way they can downgrade your plan, and you just say, "Forget about it. I don't care." Until something happens, and guess what? More money out of your pocket or a delayed, health, procedure, then you will care. But by then it's too late, and the company already made their money. So yeah, it's the whole thing is messed up. But yes, there's a form you have to give Medicare from the company. Yes, that the 564, the CMS 564, the CMS L 564 to be exact. But you just type in Medicare 564, and then also you need there's two forms, the 564 and the 40B. That's the one to actually sign up for Part B. So I have Part A, canceled B when I retired early because I had Blue Cross. I was just told no Advantage plan until I signed back up for Part B, because BC doesn't help much. Yes, that is correct. You cannot get a Medicare Advantage plan unless you have Part A and Part B. You need both of those. And if you don't have it, then if you're not in a special enrollment period, then you cannot sign up for Part B right now. You have to wait till January. So you go ahead and sign up for Part B in January. Sounds like you're going to get the penalty. And then they changed the law about a year ago. Before, if you signed up in January, February, March for Part B, it wouldn't start till July, which is really stupid. But they fixed it. And now, if you sign up in January, your Part B will start February 1st. So, yeah, prepare to sign up in January and then reach out to my partners at Chapter, and they will find a Medicare Advantage plan in your particular area. I turned 66 in May 2025. Will my benefit be for age 65 or 66 due to I turned 66? It's your benefit amount. It doesn't matter what your date of birth. I mean, and what you're talking about. Every month you delay starting your benefits go up. Whether you're 66 or 66 in 1 month or 2 months or 3 months, every month you wait, your benefit goes up a little bit. So. Uh, Ed, Chapter Advantage plan with $92 give back program. I don't go to the docs that much, so I will see how this works out. Thanks. Yes, perfect. Okay, another one that got that some money back. But as I always say on those, the Part B give back. I try to be truthful here. People try to entice you with extra money and stuff, but they don't tell you all the bad parts of that. I always say this when I talk about Part B give backs. A health insurance company, they're going to give you $94 or $100, $150 just because you signed on the dotted line. That's not a very good business model, is it? Right? Um, and these are billion-dollar companies. They know how to make money. So they get you to sign up for that. That's fine. And if you're healthy and you don't really, use it, particularly if you have the VA, then awesome. But if you don't have another fallback, remember these companies are giving that extra money just for signing up, and there's zero premium plan, so they're losing money just by signing up. How do they get it back? Well, they increase the prices for everything else. So in your particular plan, let's say they give you $100 back, but if you go to the hospital or get an MRI or a CT scan, they charge you 2 or 3 times what a normal plan would. So the same exact company has a normal plan. They have, let's say, $100 a night to stay in a hospital. Your plan, $300 a night or $200 a night or something like that. And that's how they kind of make their money back. So, but if you're healthy and everything is good, then yeah, absolutely 100% get that money back. Hopefully nothing happens next year. And then next year, if you're still healthy again, young, 65, 66, 67, 70, and it doesn't look like you're going to use, any type of health coverage or anything, then yeah, stick with the Part B, and, put some more money in your pocket. But once you start, oh, I'm starting to feel a little, feel old, then it might be better to go ahead and switch to another plan that has more coverage. So just kind of FYI, I like that free money too. But it's not free. Remember, you paid for it. That's your money. All those decades you paid into FICA, that is your money. So you're just getting your money back. So applied for Social Security in July 2024. They backdated and paid from January. Part A and Part B on Medicare card is January, still within 6 months of the start. Can I get Chapter to check plans? Yes, give them a call. Yeah, they backdated it. So your Part B technically started January, but they just adjudicated it in July. So you might be able to get some type of an exception. Yeah, reach out to Medicare and they'll look at the system and see if yeah, with your in the 6 months, where there's an exception in there. So yeah, definitely reach out to Chapter or whoever you trust, to help you with Medicare. I signed up late because my husband had insurance. I wasn't aware. I'm on a disability now. I pay $500 a month for Part B. Wow. Because my husband had, I signed up late because my husband had insurance. I wasn't aware. I'm on disability now. I pay five. Okay. But your husband had health, but I guess it was a retirement plan or something like that. It wasn't through current work. And therefore, yeah. Yeah. So, yeah, if it was like a retirement plan or something like that, then that's not credible coverage for the delayed enrollment. So but if they messed up, if it was from current employment and Social Security just messed up somehow, then yes, ask for an appeal of that. I am on disability. When they switch me to Social Security at 65, can they use my husband's record? He made more than me. Thanks. They can use that right now. If you are on disability and you're entitled to spouse benefits or surviving spouse benefits or divorce spouse benefits or whatever the case may be, those benefits are higher than yours, then you can file for those now. A lot of people miss that. There's probably tens of hundreds of millions of dollars out there in lifetime benefits that people lose because they're on disability and they don't realize that they can also get survivor benefits and spouse benefits and all the rest of it. And they think, well, if I get the spouse benefits, sure, it's more money, but then that will stop my disability, which will stop my Medicare. So they're afraid of losing their Medicare because they're under the age of 65. But no, you can have disability and Medicare and collect those extra benefits for survivor and spouse. Obviously, one offsets the other. The calculations are there, but you can have all three of those. And if your benefit amount is low enough, you can have disability, SSDI, and SSI, and Medicare, and spouse benefits, and Medicaid, and have Medicaid pay for your Part B premium, and get the Medicare Advantage dual eligible plan, and get those grocery cards that gives you some extra money, and get the extra help with your prescription drugs. And yeah, so one person can have all of that. It really depends on how much it is and how much they're receiving and all the rest of it, but that is possible. Protects RIPs and have their payments decreased due to an increase. Oh, okay. Yeah. The new one that just came out a few months ago. Yes. Hold harmless rule. Oh, not the overpayment. Protects Social Security recipients from having their payments decreased due to an increase in Medicare Part B premiums. Okay, that one. Yeah, that one only kicks in. I think over the last 20 years, it only kicked in a couple of times or something. So what that basically, I don't think it really kicks in. Well, it might. Yeah, I think it might for some people this year because the cost of living allowance adjustment was only 2.5%, and so what it is saying, okay, if we give you a cost of living adjustment of $9 and then we raise your Medicare Part B by $10, that's the hold harmless thing where they can't um, you know they can't increase your Medicare Part B more than the COLA because you'll be making less money next year. So yes, that's the thank you, the hold harmless rule. Um, there might be people out there that, yeah, if you're only receiving, very small amount, then that might be the case. I haven't heard anybody yet, and that I'd have to run the numbers. But if you're receiving 1,000, that's $25 or so. So that wouldn't. But if you're receiving less than that, you're probably receiving SSI. Um, and if you're receiving SSI, you're probably receiving Medicaid, and you're probably not paying for your Part B anyway. So yeah, thanks for bringing that to my attention. I don't think the numbers work for this particular year. Some years, the Medicare Part B increased quite a bit, but not this time around. $10, not that much, I guess, but it is if you don't have the $10, right? They may not switch you at 65. They may wait until you're full retirement age. Yeah, in terms of okay, that was I think a second part of a previous question. If you're on disability, they don't switch you to retirement at 65. They switch you to retirement benefits at your full retirement age. But your check stays the same and everything like that. But I was focusing on yeah, the fact that you don't have to wait for survivor benefits or spouse benefits or anything like that. So go out there and call and see if you got some more money waiting for you, and then check back with us and tell us you found some money, hopefully. Will my survivor's benefit amount change because my husband was on SSDI before he died at 51? Um, no. The calculation will be the calculation. Basically, he was not receiving his benefits early, so because early it means retirement benefits. He was receiving SSDI, so there is no early in SSDI. So no, everything will be the same. Your survivor benefits are calculated based on that information. So there's no anything different there. They might have they do what's called a Windex PIA. Basically, someone that passes away before the age of 62, they do different calculations based on they index his earnings um, uh, for later years. So, but that in your particular case, because there's no other things strange in there, that's a computer that is a calculation the computer system does automatically. So oh, okay. Since we could not hear you, sorry, when we could, you started saying some of us will find out we have no coverage next year. Did you mean if we didn't sign up by December 7th? Yeah. So those are the, yeah, I'll edit that first 6 minutes out. Um, but yeah, so for next year, there's close to the last numbers I've seen is 1.8 million people have had their Medicare Advantage, Medicare Part D plans canceled for 2025. It's basically the health insurance companies saying, hey, we can't make money on this group of people in this part of the country, so let's just go ahead and cancel them all. So they canceled you. And then those same health insurance companies, look at other parts of the country and say, hey, in this particular part of the country, in this suburb, in this part of the country, should we cancel them? No, we shouldn't. Yeah, I think we can make money on these guys for 2025, but we can't make money on them based on their current plans. So let's change what's under the hood, because people don't check their plans. It's awesome. It's great for us. 70% of people don't check their plans. So let's just go ahead and change all the stuff. They won't notice because they don't check their plans. And as long as it stays zero premium and they have the same card, people won't check because there's awesome cat videos they need to watch. And they'll find out next year when we charge them 2 or 3 or 4 times what they thought they were going to be charged for doctors or hospitals or whatever the case may be. So let's be smarter than these guys and review your plans, particularly this year. And you have until December 7th. Please, please, please do not wait until the last few days. Call up chapter today. You can call them tomorrow. They're going to be closed on Thursday. And then they'll be back, the day after. So give them a call. And they've already helped quite a few of y'all out, and quite a few of you are in the right plans. And that's why I chose them, because if you're in the right plans. I've already seen a lot of people put comments down there that, oh, yeah, I called chapter and they said I'm in the right plan. Awesome. They didn't try to force you into something else that wasn't good for you. If they checked your things and your doctors were covered and your particular plan in your particular area didn't change very much, or it's still the best plan in your area, then they said, you're good. We'll see you next year. Have a great day. So I like that. That's why we chose them. Let's see here. Wife 65, me 62. I haven't started my Social Security. Mine is twice as much as hers. Wouldn't they deduct 50% if she switched to mine anyway? Um, all right. So, wife is 65. So you're probably looking at, maybe if you're currently working, you're looking at a split strategy. So let's say your wife go ahead and starts getting her benefits. And then when you filed, then she can file a spouse claim. And if she's her full retirement age, when you start your benefits, she'll get exactly 50%. So if, let's say, she's entitled to $1,500 from you, um, then, and she's getting 1,000 from her own. So she'll continue to get the $1,000 from her own plus another $500 from your record. So for a total of $1,500. So that means your full benefit amount was $3,000, right? So it's not really a deducting 50%. It's just, yeah. And it doesn't affect your check whatsoever. Let's see. Currently on a Medicare Advantage, thinking of changing to a supplement, would need underwriting to do that, but not sure if I can do that myself. Tried typing rapidly before. Yeah, if yeah, You probably have to know all the companies. There's probably dozens and dozens of companies in your particular area, and some, as I mentioned, all plans, all Medicare supplement is a G is a G is a G. Medicare Supplement Plan G. The only difference is the pricing, the current pricing, and the projected future pricing. And some of these companies are a little bit more lenient in terms of underwriting, but don't be drawn in by kind of local, Northeast Texas retired firefighters Plan G, and you're like, wow, that's half the price as everybody else. Okay, you get in there, and then maybe you're stuck. Um, and then next year they double the price, and you're like, and then they triple the price or something. So be careful of those lowball offers. I always recommend kind of the national companies, and chapter can tell you exactly, hey, this particular company historically has only increased the monthly premium by this much over the last few years, so they can give you an idea of what that particular company in your particular state has for price increases. Lydia, I collect VA disability, a former government employee drawing a pension. Will this affect my Social Security check? I am looking to start Social Security in December. Um, a former government employee. If did you pay into Social Security at that government work? If it was a federal, then yes. And federal, I get this remark sometimes in my comments. Oh, if politicians paid Social Security, then they would protect it more. No, politicians pay Social Security. They changed that in the 1980s, early 1980s, where before politicians didn't pay, but as of early 1980s, they now pay, and 99% of federal employees pay. I paid Social Security when I worked at Social Security. But there are certain state, local, city governments that opt out of the system. Is about 3 or 4% of the population out there. So if you're one of those that opt out of the system, that yes, that will affect your benefits. But if you're not, and if you work for the federal government or the other 97% of state, local, city government employees that pay into Social Security, that will not affect your Social Security benefits at all. You're good. I'm on disability. When they switch me to Social Security at 65, they can use my husband. Okay, yeah. So, okay, that's the follow up question on the previous one. So, yeah, they don't switch you at 65, they switch you at your full retirement age. Um, if I work after full retirement, and widows will either be affected due to work, not negatively. No. If you're working after your full retirement age and you're receiving retirement benefits on your own record, and that new year of work is one of your high 35 years of earnings, then that will affect your benefits, but will affect it positively. So your benefits will increase, and that's automatic. You don't have to do anything. I turned 62 in August 2025. To verify, I can apply in April 25. My husband is waiting till 67. I can then see if I get any more on his. Correct. Yep, that is correct. So you turn 62 in August. If you're born on the 1st, you can start in August, but any other day, you're going to start your benefits in September, and you'll get your first check in October. So you go ahead and get your benefits, getting while the getting's good. And then when your husband files, if his benefit is twice yours, then you'll just be brought up to that amount, depending on when you file. All right. So let's see. I'm on Medicare Part A and B, but also have another insurance. Yeah, so maybe that's a Medicare Advantage or a Medicare Supplement or whatever the case may be. Yep. So let's see here. I have Medicare Part A and Part B, so I have to pay the premium. What do you recommend me to get help with paying this premium? I turned 65 June this year. Okay, so you already have Part A and Part B, so that means you're receiving. Okay, you turned 65 in June this year, so okay, so you got it based on 65, not on a disability. So if you're having difficulty paying that premium, you have two options. You get the Medicare Advantage, the Part B give back, what everybody was talking about here, and if you're healthy, that's a good option. Um, or if you're low income, low resources, you can apply for Medicaid from the state. And Medicaid, you might be able to get Medicaid. And if you get a certain level of Medicaid, They just might pay for your Part B premium. It's called the Medicare Savings Program. Um, and then if you get Medicaid and Medicare, then you can get one of those Medicare Advantage dual eligible plans that give you some extra benefits as well. All right, let's see. Uh, the coverage you mentioned for glasses, dental, hearing, et cetera, is that through Medicare or independent companies? Yeah, dental and all that kind of stuff, as we normally think about it, is through independent private companies. So Medicare Advantage, some of those plans, most of those plans have an element of dental, vision, and hearing, but there are also other plans out there, other companies out there that provide it. If I had my way, original Medicare Part A and Part B would cover glasses, dental, and hearing, because how healthy are you in retirement if you can't see, hear, or ear, right? My husband wants to collect his Social Security in 2 years at 67. He paid FICA and pension. So is he okay to collect as without a reduction? So it depends on if that is a covered pension. That means he paid into Social Security when he worked at that particular place, then he's good. But if he did not pay into Social Security um, at that particular place, then it's offset. It's recalculated. But you said he paid FICA and pension. So he paid so it doesn't affect his Social Security at all if he paid FICA on that job. Amy, I turned 70 in July. I already made more money this year than previous year and want this to count towards Social Security benefits. But I want my Medicare premium to be readjusted since now I am making less. Okay. So are you paying the IRMA, the income related monthly adjustment amount, the extra Part B premium? That's based on 2 years ago. Um, so if you've stopped making that job, or you stopped making that money that you made 2 years ago, and you reduced your earnings, or you stopped working, or something like that, yeah, you can definitely ask them to recalculate your IRMA, that extra Part B premium. It's an SSA 44, a life changing event. Um, and in terms of how much money you made this year, when you file your taxes next year and send them to the IRS sends it to Social Security. And if that's one of your high 35 years, then your monthly Social Security check increases. That is 100% automatic. You don't have to do anything. Have you reached out to ARP and similar organizations who can advocate for your recommended solutions for solvency? Yeah, definitely reach out to them, but I think reaching out directly, ARP, they already do their thing, but even they ask you, hey, contact your senator, contact your House representative, your congressperson, and tell them, here's what I want. So. I'm divorced, but my wife recently died, and we were married for over 20 years. I'm single and 59. Can I get her Social Security? Can I still work and get her Social Security now while I wait to draw mine later? Not now, unless you're disabled. But if you're not disabled, you can next year when you turn 60. But there is a work limitations. Next year, um, $23,400 next year. Anything over that, Social Security holds back $1 for every $2 you go over. And yes, you can delay yours up until you're 70 years old. And so you can collect survivor benefits for the next, 10 years and then switch over to your own when your benefit amount is higher anytime between now and then, or 62 and then. Let's see here. Also, when he passed, am I eligible on my own as with Social Security reduction because I will be getting his pension? Again, pensions don't. Social Security doesn't care about pensions because when Social Security was started back in 1935 by FDR, it was supposed to be three legs of the stool. It's supposed to be your pension from work. It's supposed to be your savings and also Social Security. Now, those defined pension plans where you worked 50 years and get a gold watch and taken care of forever. Those are pretty much going out. Savings, every time there's a crash, people lose savings. I was, around during 2008 and all the rest of it. When, it was tough. It's going to be, anyway. But if it's just a normal pension that based on work that you paid into Social Security, that has no effect on Social Security whatsoever. Social Security loves when y'all have your pensions That's what it was designed for, is to supplement those pensions and savings. Has there ever been an increase to Social Security benefits without an increase to Medicare premiums? Has there ever been an increase to Social Security without an increase? No, I think Medicare premiums, yeah, have almost always increased. There was one year, a couple of years ago, where it increased less. Um, but yeah, there's Medicare premiums are almost always increasing. I have insurance through my wife's employer and Medicare because of my disability. Her insurance plan has $3,000 deductible. How does it work with the Medicare Part A and Part B? All right. So, yes, good question. In that particular case, you might want to do is um, because you have health insurance through her work. But if it's just like a hospital deductible, then you go ahead and you keep your Part A, and that because for this year the deductible for Part A is $1,632, but that could be several times a year too. So that's not a one-time deductible. Um, but if the $3,000 is across the board deductible, yeah, you might want to consider getting go ahead and get Part A and Part B, and then, getting some other type of plan. But it really depends on the details of your health insurance from her work. You don't have to get Part B because you have health insurance from her current work, and I assume her employer has 20 or more employees, so you're good there. You don't have to get it, but maybe in your particular case, you need to run the numbers and say, okay, $3,000 deductible. How healthy are you? Are you going to maybe use it next year? And see, where you're going to save the most money. All right, I've got we're running out of time here. Let me get a couple of questions from people I've never seen before here. My sister, 78 years old, was widowed 5 years ago. She made more than her husband, a Vietnam vet. She's collecting his vet benefits, but not his Social Security. Can she collect the latter? No, because it sounds if she's currently receiving benefits on her own record and those are higher, then there's no benefits on that. Yeah, so the other benefit has to be higher. You always get the higher benefit. And I just filed September 6th of 2024, and I've already went to the process of giving them all the information okay, I'm not sure what that part. Let me get one here. I want to file for retirement Social Security. Will this hurt me when I get my compensation for my car accident? No, none of that has any effect on your Social Security retirement benefits at all. I'm divorced, but my wife recently died and we were okay. I already answered that one. All right. I just punch these and see what comes up. All right. Okay, let's see if this is a good one. I'm on Social Security disability, age 58, covered with my husband retirement health insurance, lifetime benefits paid by the state, and I don't have Medicare. I will be penalized. Not if you don't sign up. You'll never be penalized unless you change your mind later and go sign up for Part B and Part D. If 5 years, 10 years, 20 years down the road, you decide you're going to go ahead and sign up for Part B or Part D, yes, then you will be penalized. But if you never sign up for it, you will never be penalized. So, all right, that is it for today. I apologize for no audio for the first few minutes. I'll go ahead and re-edit this video, cut out that first 6 minutes, and I'll repost it. And I will be back again tomorrow, and we'll talk about some good, bad changes for 2025, 2026 with Medicare Advantage and all the